Hey guys, how are you? Good afternoon. We're here in sobedentist.com and we're really excited because today we're starting a new phase of sobedentist.com. We're going to start blogging because we would really want to hear your comments and your interests on what would you like to know about your first visit or when you come to the dentist education. What would it be that you would like to hear from us? Basically, we're going to start with dealing maybe with, at a week's time, we're going to take a topic and we're going to go ahead and mix your comments and your interest on that topic and answer your questions and also give you a little bit of feedback on that week. So we can maybe choose the topic between our office, sobedentist.com, and you guys, our patient of records. When we hear questions in our office, we'll go ahead and maybe take the most common question, answer it in that week, or the concerns that maybe we see mostly in our patients on that week, or the concerns that you guys have and that we're really hearing on that week. So as far as this week has started, and we're going to start you off with something that has been basically our concern, I would say probably in the last couple of years, not only in our office, but also that in the medical field, we are dealing it more with it now. It's not sort of something new because it's not new to snore, but a lot of people are saying why are people news, and it's all over the newspapers, and why people now paying so much attention to the snoring. And it's really basically because snoring has been taken very, very lightly. I actually, in our medical history in our office, we have a questionnaire, which is a whole page, and I think it's actually funny to me, which is called the bed partner questionnaire. And the bed partner questionnaire is for your bed partner to answer. And it's basically because we are not aware if we snore or if we don't snore. The person who's aware if we snore or not is our bed partner. And actually sometimes even the bed partner suffers more than the snorer, because then they can't sleep. So now we're having actually two people affected by a disease. Now, does that really mean that if you snore, do you suffer from a condition called sleep apnea, which is complete sensation of no oxygen? Or is it actually that if you don't snore, you don't have sleep apnea? So either or. A patient could snore and have sleep apnea, or a patient could snore and not be suffering from the disease of sleep apnea. So basically what we're concerned about in our office at sobedentist.com is actually diagnosing, and the first thing that we do is we do a screening on most of our patients. Everyone who comes in here, we screen them, and we ask a couple of basic questions such as how do you feel when you wake up? Are you feeling tired? How do you sleep? How many hours do you sleep? Do you fall asleep sometimes when you're driving? If you're talking to maybe your friend or so forth, do you fall asleep? Are you maybe picking up a book and after maybe 10 or 15 minutes are you falling asleep? Are you falling asleep when you're watching a movie? Do you spend most of your day tired? Are you snoring? Those are basic questions that we ask. Then after the screening, what we usually recommend, and we always recommend, is for you to go ahead and visit a sleep physician. A sleep physician, they're the ones who are basically educated in sleep medicine, because sleep apnea is not the only thing in sleep medicine. You can be suffering from other things within sleep medicine. So we go ahead and screen you here at sobedentist.com. Then we go ahead and refer you to a sleep doctor. This sleep doctor, what he will perform is a test called PSG. And then after this test, basically we go ahead and get our results. And then depending on your results and the recommendations of the sleep doctor, we always follow the core recommendations of the sleep doctor, he can recommend you either to use a treatment called CPAP for your sleep apnea condition, or he can also recommend you a sleep appliance. And actually that's where we come in. And this is what we call the sleep appliance, and it looks something like this. And it goes on your upper jaw, on your maxilla, and then it also goes on the lower jaw, on your mandible. So you would basically sleep with this during the night, and it looks like this, and this is how you would this is how you would sleep. Yes, the
the mouth is shut together, so we also have to make sure that you're breathing correctly through your nose. So that's another evaluation that we also like to refer to an ENT and make sure that your nose is clear and that everything else is, all the other passages are all also clear in order to use a sleeping device. Now the important thing to understand is that a lot of dentists make snoring devices. They're not the same thing. This is an apnea device. This one in particular, which I love, is the Sonodent appliance. There's other appliances also that I use. I'm very familiar with this one, and I've had awesome results with my patients with mild, moderate, and some severe cases, or let's say non-compliant patients that they really don't want the mask. They're traveling too much to be traveling with that mask, and they have the cute girlfriend or the cute boyfriend, and they really don't want to sleep, not too sexy to sleep with that starbaiter little mask. That's what I call it. But that's up to the sleep physician ultimately to decide, and he's the one who authorizes us as to with what treatment is best for you. But today we're basically I introduced you a little bit to the alternative, and that's why we're basically here, to give you choices and alternative to the disease called sleep apnea. It's a very severe disease. I sometimes tell patients, there are patients out there who are dying in a dentist chair because not every dentist is trained to diagnose this disease. So you have to also be prepared and have the continuing education in sleep medicine to screen your patient for sleep apnea. I guess maybe tomorrow or next time around that we get together, we can maybe talk a little bit more about sleep apnea, bring out your questions, your concerns, your comments, anything that we're also hearing here within my staff. My hygienist picks up a lot of tips from the patients asking her things, why are you guys asking this question? Who am I sleeping with? Not who am I sleeping with, but how are you sleeping? And so forth. And then we'll go ahead and continue with this for this week. And if you guys want it next week, then we'll continue to talk about sleeping also next week. So till next week, and remember, sobedentist.com, taking care of all your needs and changing lives by saving lives. Thank you.